He is standing at the kitchen counter making coffee, the same thing he does every morning, when his right hand goes strange. Not painful, not numb exactly, more like the signal between his brain and his fingers briefly lost its connection. He sets the mug down. He flexes his hand. 10 seconds later, everything feels normal again. He finishes making the coffee. He sits down. He does not call 911. He decides it was nothing. 48 hours later, he is in the emergency room. What happened to that man in his kitchen was not nothing. It was a transient ischemic attack, what doctors call a TIA, and it is one of the most time-critical events the human body produces. In the United States, a stroke occurs every 40 seconds, and for adults over 60, the stakes of ignoring a minor symptom are incredibly high. TIA symptoms, by definition, resolve within minutes to hours. They disappear before most people think to mention them, but research makes it unmistakably clear. A TIA is a warning shot. In many cases, it is the body's most explicit signal that a larger stroke could follow within hours or days. My name is Dr. Evan Noris. I am a vascular neurologist with 24 years of clinical experience focused on stroke prevention in the U.S. healthcare system. What motivated this video is the consistent gap between what people experience and what they recognize as a reason to act. After 60, your cerebrovascular system is operating under different rules. Decades of wear have made arterial walls stiffer. Plaque, the buildup of cholesterol and calcium, has narrowed the channels. Think of it like a partially rusted pipe in an old house. It is far more likely to fail under pressure than a clear one. At 30, a brief blockage might be a flicker. At 70, that same blockage can extinguish brain tissue permanently. According to the CDC, stroke is a leading cause of serious long-term disability in the U.S. The warning signs we are going to discuss are the body's clearest language. In the medical community, we use a life-saving framework called BE-FAST. Balance, eyes, face, arms, speech, and time. If you notice a change in any of these, the time to act is 911. Before we dive in, I want to ask, has anyone in your immediate family ever had a stroke or TIA? Type yes or no in the comments. Family history is a massive risk factor that we must account for. The first warning sign is sudden, brief, one-sided weakness or heaviness in the arm or leg. This is what the man in the kitchen felt. It is a focal motor deficit. Imagine your brain as a sophisticated control panel. When blood supply to one section drops, like a power surge dimming one circuit in your home, the function fails. In seniors, this is rarely a fluke. Crucial safety note. If this happens, do not take an aspirin or any blood thinner yourself. In the U.S., many people instinctively reach for aspirin, but if the stroke is hemorrhagic, bleeding, aspirin can be fatal. Let the doctors at the hospital decide after a CT scan. The second sign is amaurosis fugax, a sudden shade or curtain dropping over one eye. This isn't an eye problem, it's a carotid artery problem. It means a tiny piece of plaque may have broken off and briefly blocked the blood flow to your eye. Sylvie, a patient of mine, ignored this for 2 minutes, thinking it was just a tired eye. It was actually a warning of a major carotid blockage. The practical fix. Any sudden vision loss is an emergency until proven otherwise. The third sign is word salad, or sudden confusion. This isn't senior moments or forgetting where your keys are. This is mid-sentence. The words simply vanish. It's like the brain's library door suddenly locking. Nkechi, a former interpreter, experienced this. It led us to find her atrial fibrillation, AFib, a heart rhythm common in the U.S. that causes clots. The practical fix. Sudden word loss is a neurological signal. Call your doctor or 911 immediately. If you are still with me, type the word aware in the comments. Awareness is the first step toward prevention. The fourth sign is the thunderclap headache. This is the worst headache of your life, arriving at full intensity in seconds. It can signal a subarachnoid hemorrhage. After 60, vessels that have endured years of blood pressure changes are more fragile. Olivier, an architect, felt a pain like he'd been hit from the inside. He didn't wait. He sought help, and we found a small bleed before it became catastrophic. The practical fix. Do not lie down. If it's a thunderclap headache, go to the ER. The fifth sign is sudden, unexplained vertigo or loss of balance, especially if you see double or your speech slurs. This involves the posterior circulation, the blood supply to your brainstem. This area controls your very consciousness. Priya, an engineer, felt dizzy for 20 seconds and saw double. She thought she was just dehydrated. It was actually vertebro-basilar insufficiency. The practical fix: dizziness plus any other neurological symptom equals emergency. Here is your action plan. If you are over 60 with high blood pressure or AFib, ask your doctor for a carotid duplex ultrasound. Ask about an EKG to check for hidden heart issues. And most importantly, memorize BE fast. Stroke prevention is a medical specialty. Your individual risk, your medications, and your imaging results define your plan. Bring this information to your physician as a partner in your care. And if you want to know the top 3 dietary shifts that vascular research shows can strengthen your arteries from the inside out, stay tuned for my next video.